Good morning, supervisors. Thank you very much for having me today. Just on a first message, we really want to encourage all residents not only to follow our guidance with wearing face coverings and sheltering in place, which still remains in effect, but also to take care of themselves. One of the strongest protective factors we have against COVID-19 is staying in good health and caring for ourselves. So sleeping, eating healthy, getting outside and exercising, finding stress management techniques, those are all great strategies as we do see the increase of COVID-19 in our community. Those are strategies that can protect yourself during this time. So just really encouraging everyone to care for themselves. We have now more than 2,600 cases of COVID-19. Again, this is an expected trend as we did have sheltering in place restrictions and we do have more open businesses. So that is to be expected, but we are taking great strides to reduce that number or reduce the pace of that increase. So our current case rate, which is followed by the state and places us on the state monitoring list, is 245 cases per 100,000 people in the last 14 days. And that number has been declining. And it's important to note that that number does not include San Quentin. I know many residents are concerned of the inclusion of San Quentin for our placement on the monitoring list, but it does not include San Quentin, whose rates are also decreasing at this time as it shifts to the other side of the epi curve or the outbreak. We are having weekly meetings with the state where we monitor our data and provide information around our mitigation strategies to reduce transmission in our community, which includes enforcement. Another big practice we have is working in the canal. Our team is in the canal today working on a new surge plan with our partners, including City of San Rafael, Multicultural Center of Marin, Canal Alliance, also Marin Community Clinics and Marin Health, who are all have teams on the ground today to, again, increase outreach and education from the individual level to the business level to, again, address that surge of cases in that community. Another big win for us this week was the transfer of testing from county-based testing to color testing, which started last week. This has been a soft launch where we prioritize testing of staff who work in congregate living facilities, so skilled nursing facilities, long-term care facilities, and a group we call other group living facilities. So we've prioritized that testing. On a very positive note, we have automated processing of negative results, so people will be getting their results within a day to 2 days, which is a major improvement from what we've seen before. And we are closely working to automate the positive results. We're doing that with our IST team. So we're looking forward to, again, improvements in any backlogs that we're seeing before. The second thing that relates to our backlog is our ability to do contact tracing. So testing and getting fast results is our first tool, and then the ability to complete case investigations and contact tracing is our second tool. And yesterday we had our largest staff. We had 17 staff. This includes 12 of the public health investigators who were approved by the Board of Supervisors to be hired. And so that's a huge win for us. And many are bilingual, which supports our ability to do outreach to this population, our target population. And then we're fortunate to have conversations with MAPE, who have approved us moving forward with contracts with community-based organizations for contact tracers, which is different than the public health investigator role, but is also a critical role for us being able to clear the backlog of positive results that we're seeing. And then lastly, a lot of our efforts right now is focused on our skilled nursing facilities. We have 29 minor outbreaks among all the congregate living facilities in Marin County, and we have 5 major outbreaks. We brought on a new public health nurse to increase our ability to go on site and provide infection control support, as well as other resources and supports to this very vulnerable population. As Dr. Willis discussed at his last presentation, the majority of deaths in our community are among residents of these long-term care facilities for the elderly. So this is a top priority area for us. And we have been working since March in partnership with Marin Health, Kaiser Permanente, and the county to be able to have testing on site at these locations, as well as provide infection control support. And so that is the conclusion of my update, and happy to answer any questions.
All right, thank you, Dr. Santora. Matthew, anything that you want to add on to your part of the administrator's report, and then I'll go to questions from board members?
Yeah, I think the only thing I would add is a couple of housekeeping items. I just wanted to point out staff has revised item 8, the staffing report to correct the fiscal year to the current fiscal year 2021. You'll hear that on your policy agenda. And then the last item on your calendar today, your second afternoon item, the appellant has requested that this item be continued to a later date. So I just wanted to point that out as well.
Okay, great. Board members, questions for either Dr. Santora or Matthew? Judy.
Yes, thank you, Dr. Santora, for your report. I know that we generally, when we either go forward or retreat, that we then see how that worked every 3 weeks. When we had our last announcement, I'm not sure how long ago, but the nails were getting ready to open, and then quickly they said, no, you have to pull back. When is that, so things like that, and restaurants, etc., going to be looked at and studied again to see how we need to deal with it?
So at our weekly meetings with the state, we review our data and ensure that our data, which we collect and promote widely on our website, is reconciled with the data that the state is seeing. So that is one purpose of that, and it's also to review how long have we been on the non-watch portion of being on the monitoring list. So we need to have at least 14 days for us to be off of the monitoring list now in order to resume regular activities under the discretion of the state. As you have seen, that the state guidance has changed, and it changes as we saw the surge in the statewide, where we always must defer to the state for how strict we can be in how strict we can be with our sheltering in place. So that's our North Star is the state guidance. So that being said, there is a new mechanism that requires the state health officer to approve us moving forward, and we are seeking clarification from the state so we can have more information for your constituents as well as local businesses to know and plan for timelines of reopening. But at a minimum, it needs to be 14 days off of the monitoring list. That is a change from when it was 3 days. There was a time when it was only 3 days. So that might be a number that you may have heard previously that has shifted to 14 days.
Thank you.
Damon.
Thank you. Good morning, everyone. Thank you, Dr. Santora. You briefly discussed testing. First question is, have the recommendations changed on who should get tested? And where do things stand with the supply of tests?
We are seeing nationwide at the state level as well as locally limitations in testing, which has resulted in reprioritization of testing. That affected us at the state level even. We do use the state lab for our testing, and we now need to assign a prioritization group to any labs that we're submitting, and that's just due to volume overload at testing facilities, both public and commercial testing facilities. We still have the recommendation as of today that essential workers should get tested no more than once a month. And that's consistent across the county, but we'll be reviewing the utilization of our testing site as we see other testing resources statewide reduce. So this is going to be something we follow closely. We will always want to prioritize testing for those groups that can have a significant impact by knowing those results, and that again, our priority is working with the skilled nursing facilities and the residential care facilities for the elderly in order to ensure that their staff are tested consistently, because we have always had a very proactive approach. Once we know that either one staff or one resident is positive, we do a rapid case investigation and contact tracing to identify if we need to test the full facility or we need to test a portion of that facility, because that is the way we can slow the spread of a disease, prevent an outbreak, and reduce mortality significantly. So that will always be our top priority.
How long is it taking to get test results in Marin?
With color testing, we're seeing a test result turnaround within 1 to 2 days. Typically 36 hours is, I would say, the average for the color testing. With our state lab, with the new prioritized testing, we're seeing probably 2 to 4 days, and our county lab or our regional lab has the 1 to 2 day range. The challenge with those second two groups that I mentioned, where color audit is automatically processing, we still depend on county staff to process the results that we receive from UCSF, the state lab, VRDL, and the county lab or regional lab. So that does add a delay in time when it's literally splitting up PDFs and processing them. So, which is one of the reasons we moved forward with our recommendation for color, because it is automatic processing that will directly connect to our new data system.
Great. You mentioned residential care facilities, skilled nursing, and I think it's safe to say I and many others are concerned about the cases that are occurring in those facilities. Do you believe that the operators are doing enough?
I think what we're seeing is that the operators have limited resources. The staffing profile of low-income staff, many from communities of color who have been more impacted by COVID-19 infection, either if they live within Marin County or outside the county, affects staffing, which makes it challenging. And it's also a higher turnover staffing model in many of these facilities because it's low-income staff that are providing many of these critical services, either in the care facilities or in the medical facilities. So I think it's a challenge for operators how it is currently licensed and almost the business model of these facilities. It is not designed for an outbreak response. They do have responsibilities. Their CDSS is responsible for licensure of the residential care facilities for the elderly. California Department of Public Health is responsible for the licensure of the skilled nursing facilities. So these are licensed facilities. But again, I think their business models and staffing models prior to COVID-19 made their vulnerability even higher.
Yeah, I mean, this is probably a longer conversation, but I think key questions based on those concerns that you've expressed are what more can be done to ensure that staff are trained on how to do their jobs at these facilities without transmitting the virus, ensuring that they have adequate PPE to do their job and that they, in fact, are not spreading the virus from one facility to another. So to the extent we can be proactive as part of ensuring that, as you say, likely fighting perhaps a corporate culture involved or whatever the case may be, I think that's something we need to be proactive toward. San Quentin, obviously of ongoing concern. If you could quickly touch on how many hospital beds in Marin currently have San Quentin patients.
As of my last look this morning, there's 5 San Quentin inmates who are currently hospitalized in Marin County, and that is a significant reduction. And it's consistent where they are on the downward downside of the hill of an epi curve. So we'll continue to see reductions in the number of reported active cases in San Quentin. We've also cleared a critical period. As many of you know, it's that first 2 weeks after infection, especially that second week when we see that surge of acuity in a COVID-19 infection, which results in hospitalizations. And that's what we experienced starting 2 weeks ago after that initial introduction of COVID-19 in the community.
And looking at the data, it appears that COVID positive inmates are being discharged from San Quentin. Mm-hmm. Do we have a sense of where they're going once they're discharged?
They're released to their home county. The CDCR has been making improvements in the notification of health officers and probation and ensuring housing. It was an issue we saw in the beginning where there was release of inmates into without sufficient housing. So there's been improvements in that and increased investments at the state level of some of the coordination of these releases. So that's something, but we've worked with the public health and the probation department in Marin County for those inmates who are Marin County residents. There are not many of them, but there have been Marin County residents who have been released. And some of them were not released in the ways that we would have recommended to make sure that we are notified of their of whether they're in quarantine or a positive case. But there have been improvements over the past 2 weeks in that notification process.
Great, thanks.
And I just want to comment on one more thing. I think what we've seen with this outbreak and this pandemic is this definition of essential workers, people who have been required to work since the beginning. And I think what we've seen statewide is many of these essential workers do not have living wages, they do not have essential benefits, and really struggle. And I think that's something, especially in the nursing homes that we've seen, many individuals are forced to work in multiple facilities because they just for wages. And so I think that's, again, a space where Marin County leading and having a living wage ordinance and continuing to advocate for that, and also looking at benefits. Many of these individuals do not have healthcare benefits. It's a mixed picture depending on the facility. So there are great improvements that can be made. And I think licensure, both CDPH and CDCS, will need to have a hard look at what do these facilities look like in the months to come, and make legislative changes in these areas. So.
Dennis.
Thanks. We look forward to working with you on those issues.
Thank you.
Thank you, Dr. Santora. I was wondering if you could just comment on the hospitalizations. I noticed yesterday there seemed to be a significant drop in the number of people in hospitals right now from the COVID. You'd comment on that, and then also just comment on the total number of contract tracers we have in Marin.
So the hospitalizations, we are seeing a drop, and that's being seen across the state as well, where we're seeing cases increase and we're seeing hospitalizations actually flatten rather than the ongoing increase. I think some of that might just be related to the cases themselves. We saw increased activity related in early June through some demonstrations and also personal gatherings. I'm hopeful that as California residents and Marin County residents have seen these increases in rates and attendance at family gatherings or larger gatherings, that they reconsider that. We still recommend keeping it small. And so I think that's why I think unfortunately, people did loosen up in their sheltering in place, and that resulted in increases in transmission, and why we're again shifting back to really trying to reinforce the critical importance of sheltering in place and staying vigilant. And Angela Nicholson will be describing later some of the enforcement mechanisms that we're looking at. So I think that's the hospitalization picture that we're seeing. And the second part
was about how many total contract tracers we have.
Great. So we have over 70 contact tracers now, 35 of whom are Marin Medical Reserve Corps volunteers. And we still have around 12 of them are disaster service workers, so county staff from other departments who've been assisting us and been assisting since the beginning. And then with the addition of the public health investigators and additional public health nurses, that we round out probably 25 public health staff. So then we're looking at 5 additional contact tracers through our contract with community-based organizations. And then moving forward, also, you may have seen, we're looking with the Dominican University as well as the College of Marin of having students engaged in contact tracing as part of their learning experience.
And thank you for your report about the testing time turnaround, because I know that's been a major concern with our businesses, because there's been a long wait to even hear if an employee tests positive. And that's been a struggle for them to staff their businesses. So I'm glad you've turned that around. And it's,
yeah, and just to caution, like if you're still getting tested through Quest, there will still be significant delays. So that's why we're trying to prioritize our use of our access to color testing to those groups that we need rapid results. So again, that's something we'll continue to work on, but just it truly does depend where you do get tested, how fast those results will be.
Thank you.
Any other questions?
And not a question, but a comment, Dr. Santora. I really want to thank you for what you said about essential workers not really getting treated as essential people in the workplace. And I think there really may be a need for focused attention to licensing requirements for our skilled nursing facilities and operating requirements to make sure that a business model that is in fact not effective and not positive in this kind of a circumstance is given every licensing and state requirement incentive to change so that the people who are most vulnerable, that being both the residents, but particularly the essential workers, are treated in a way that reduces everybody's risk in the future. So I appreciate your giving a shout out to that. And I know, as Supervisor Conley said, we're all interested in helping do whatever we can to make those changes necessary to make sure that we're all safer in the future. Thanks.
And I would just add on to that. I really appreciate your comments and observations, Dr. Santora, along those lines. There are low-income staffers, whether they're in residential care facilities or grocery clerks or whatever, are lower income because of the unfairness of the wage structure. And of course, it's the vicious cycle. If you're lower income, you are going to be more stressed on the housing side, which creates the living situations that aren't as healthy as they could be and safe as they could be, and on and on. So anyway, we really, we're all behind you, and all recognize the importance of that issue, especially in the residential care facilities. But appreciate your observation and sharing that. I just have one question. Can you just walk through really quickly the role of and the authority of the local public health order versus the state order, and then the decision tree around, and this is with regards to schools and the decision making that will be happening around individual school districts or schools moving forward with classes?
So we always have to defer to the state. So the state can implement more strict requirements or orders regarding schools. They have not yet done that, except they've added a new requirement for a waiver in counties that are under the monitoring list, which includes Marin County. We've not yet seen what that waiver looks like. We were anticipating getting a copy of that last week, and I'm hopeful that we'll get it this week. And once we review that waiver process with Marin County Office of Education, then Dr. Willis will determine how such a waiver could be implemented in Marin County. So we haven't seen sufficient information from the state to determine the next steps yet for schools in our community. There's been a lot of news around Centers for Disease Control. They released updated guidance, and we'll be reviewing the guidance. In June, we released our 30-point guidelines for reopening schools, prior to having something similar from Centers for Disease Control or California Department of Public Health. So we'll be working to review our 30-point guidance document with what's been recently issued by Centers for Disease Control, see where there may be some adjustments, again, as we continue to work with local districts to get schools back on site. We really fundamentally believe that in-classroom education is critical for us, especially with an equity lens, where we'll continue to see the educational attainment gap increase if children, especially from low-income communities and communities of color, continue to be excluded from in-classroom education. That being said, we fundamentally support the need for having safe learning environments for all staff and all students and teachers. So it's an ongoing conversation Dr. Willis and I will continue to have with the schools. Ultimately, it's the local school district that is the decision maker. So we, as the state, can provide orders. The county can also provide orders, but ultimately it's the local school jurisdiction that can have more strict implementation of any guidance. So it's up to their discretion with our guidance and recommendations.
Thank you. I think that's important for folks to understand.